I am your bartender.
I am your program trainer for people with disabilities.
I'm your neighbor.
I'm your RV repair technician.
Everybody will get sick. It doesn't matter if you have health insurance or don't. Everyone's going to get sick. And at those moments of illness, we often have some of our greatest needs. When you are ill, you want to be taken care of. That's human nature. But can you imagine what it must be like if you are young, you become seriously ill, and you need health care, and there's no one to take care of you?
As a bartender, and like so many people in the service industry, healthcare isn't really an option that's offered through your jobs, and it wasn't something that I could afford at the time. And I liked to play basketball, and I was playing basketball at the North YMCA, and I dislocated my knee, which meant I also tore my ACL, my PCL, my LCL, and had a substantial amount of nerve damage. I didn't have insurance.
These patients are citizens of Sedgwick County, but in addition, they are our friends, maybe our children, people that we know. They come into our system, which allows them to have this more comprehensive care through multiple specialists who give their donated services.
I was working home health care. My job was a small company, and they didn't offer insurance because we didn't have enough people to qualify for insurance. I was having blurriness, headaches, dizziness, and I knew I didn't have insurance, so I couldn't go see the doctor.
I was working at a call center. I had major health issues, major dental work, and I didn't have insurance there because it was too expensive. That's where this all started.
I had the opportunity to be a manager for the RV shop, and the guy that owned it wanted out of it within a year, and I took it over. Unfortunately, it wasn't making enough money to be able to pay, and I thought I had the flu. And so it continued, and I had a backache. It really wasn't the flu, and it wasn't really a backache, but it was my kidneys failing. I had stage 4 cancer. So I was given 3 years.
When a patient is diagnosed with a major medical illness, there are lots of moving parts in the medical community that are necessary to treat the patient and can be costly. In my field in particular, I'm a radiation oncologist. With radiation services, there's about 20% of the cost attributed to the physicians, and the other 80% would be going to the facility that owns the radiation machines that actually deliver the treatment. So even if I was willing to treat a patient with cancer and provide my own services for free, I wouldn't be able to do that unless the facilities I was working with were also willing to donate. Project Access is instrumental in helping to coordinate the care of these different facilities so that the patient can receive the treatment they need.
This program does not take a lot of money out of the healthcare system. It allows us to keep track of the dollars. It allows for us to manage the case better in a more comprehensive fashion. It treats patients like they would want to be treated.
Project Access mean the world to me because if it wasn't for them, probably wouldn't even been alive right now.
Project Access are amazing. They're all angels. They have totally changed my life for the better, 180 degrees.
I would not have nearly the life that I have or nearly the options that I have now without Project Access. Without the backing of Project Access, without the accessibility of Project Access, I wouldn't be able to be doing what I'm doing now.
Because the bottom line is, if it hadn't been for Project Access, I probably wouldn't be here today. About this time I'd be going. But I'm not. I think the important thing to understand is I was never treated like a second-class citizen. So I can't say enough good things about Project Access.
As we approach the 20th year anniversary of our program, we need your help so that we can be around another 20 years. If it weren't for the help of people like you, Project Access wouldn't be able to have done what we've done for the last 20 years. We've helped over 13,800 people and essentially have saved their lives, and we have to rely on support from people like you in the community to keep our program going.